Hello, everybody. Today I'm sharing my interview that I conducted with Lorena Sanchez, a licensed family therapist in Northern California that assisted me with this interview. Lorena is a licensed marriage family therapist who has been practicing for over 20 years. She specializes in trauma and addiction and has been working with individuals with severe mental illness. She's also worked with the homeless population. She's worked with children and teens, and now her interest is peaked through psychedelics. She said that her interest for psychedelics came while she was in graduate school, where she was able to read books about it, research papers, and articles that talked about psychedelics, and that's how she got started. Why psychedelics? After practicing for several years, she realized that therapy does not do a lot for patients with severe mental illness, and neither do psychotropic medications such as antidepressants, anti anxiety, stimulants, antipsychotics, and mood stabilizers. She felt like they mask the people's problem but never really addresses the issues they're going through or heal them. When she saw this happening, she became more and more interested in alternative approach to pharmacology and started researching the whole mind-body approach. Her first experience with any sort of drug is with MDMA experimentation, and she shared that she tried it personally and felt incredible after months after. She shared that she did it with a friend in a safe space and just had hours of conversation with this friend, which she found very therapeutic and very healing. That's when she conducted her own research on psychedelics, reading about it and becoming a MAPS member, and then later on becoming a certified practitioner. Psychedelics is considered harm reduction, and it's more important than abstinence. So it's basically using the drug to change consciousness in a safer manner. It is necessary to prepare the client with discussing about the whole experience and what they're about to go through. It's also important to answer any questions they may have. Set and setting are the most important in this experience. Preparation sessions are essential to talk to them about what's going to go on, how it's going to affect them, what their body is going to feel. It has to be a calming experience, a safe place. Otherwise, the person will not have a full experience. It's necessary to have consent for touch. She talked about music and picking music and having a psychedelic playlist. And it's important to have music with no words, as it can influence how the patient is feeling. Boundaries are important. If the client says they don't want to be touched, you have to honor that. The psychedelic integration support depends on what the person wants to do. So there's no guide afterwards. Unlike therapy, you basically ask the client, what did you experience? How was it like? What are some things that you're having problems with? What do you want to talk about, basically? We talked about the psychedelic experience and what it's like. So when the drug is administered, it could go in a few different ways. So it could enter the body through injection or IV, which goes through the whole body system a lot quicker. Lozenges can take about 5 to 10 minutes to digest. Psilocybin can take about 30 minutes to digest. So when it comes to the client's experience, ketamine is about a 3-hour session and can probably be managed by one person. So it's 3 hours from beginning to end. So from when they digest the ketamine to the end of their trip. Psilocybin can take between 8 to 10 hours, and that goes for MDMA and LSD. She said that the rising cost of having a psychedelic experience comes when you have to have a doctor in the room, you have to have a nurse in the room, you have to have 2 therapists in the room, which drives the cost higher. When I asked her what the therapist's role is when it comes to the psychedelic experience, she mentioned that she sees herself as a container. She's there to help find answers to the client's questions, and is also there to support and guide them through the experience. We talked about current research that's interesting. She was talking about microdosing, how she's very interested in learning more about microdosing. I guess there's not a lot of research out there for that yet. She's because trauma and addiction is her specialty. She's also interested in the trauma aspect of the research. She's also talking about death and dying, depression, and anxiety. So some of my key takeaways include preparation, and seeing the client go through the integration. Basically, psychedelics brings out what the person needs to work on themselves. So if you don't work on it, it leaves it open and leaves you vulnerable. So it's important to guide that person to seek therapy after their psychedelic experience. So integration is important. The some of the methods that she talked about are IFS, brain spotting, and somatic therapy. It's important to be involved with whether it be reading, through research, just to be able to understand psychedelics more and the experience and what it's going through in the in politics and everything like that. It's important to learn about the whole system, connection with people that are practitioners or have gone through trips. It's important to volunteer, like she was talking about the Zendo project and the crisis line for people that are tripping, so that you can actually understand what the other person is going through when they're going through a trip. It's to for me to understand what they're going through. It's important as a practitioner to take care of yourself physically and mentally. Have a peaceful home, exercise, eat well, hydrate, meditate. These are the things that we should be doing as human beings, but we tend to forget because we're so busy. But this is most important before going into a psychedelic going to psychedelic therapy and leading a person through it. It's important to have all these in line, because you have to be in an utmost peaceful place yourself in order to lead somebody through. I need to stay on top of research because there are so many research out there. It's important to be part of groups, part of different programs, to not only read but to understand where this is going. We talked about understanding your client's needs. Not everybody qualifies to get psychedelic treatment. We talked about when I first started going to this class, I thought, oh, anybody have the experience. But no, not everybody can handle it. If we really have to stay on top of making sure that we get the client's history and their family history, because some people that have personality disorders, or history of bipolar or psychotic disorders can just exacerbate their condition. Some book recommendations that she gave me: she said The Cosmic Serpent, The Way of Psychonaut, Psychedelic Explorer's Guide, How to Change Your Mind, which is a documentary on Netflix, LSD, The Ways to Heaven, and Acid Dreams. This is the information for my references. Overall, I enjoyed this interview. I really had a lot of fun and got a lot of information from Lorena. And thank you for watching.